Well, thank you again for joining us. I appreciate everybody's time. I know benefits sometimes can be a little daunting and not so exciting. And so I just really want to give everyone some time to go over some of the choices that are available for open enrollment this year. So Nina, you can start to change the slides if you don't mind. I am going to see if I can blow up the slides so I can see it a little bit better. So the first slide is going to talk about basically the dates for open enrollment. This year's open enrollment, it starts on Monday. And so, it's going to start Monday, October 19th. Starts at 8 a.m. You sign in through Wolverine Access self-service, and it goes until 5 p.m. on Friday, October 30th. It does close down right at 5 p.m. So if you do, forget to go in and make any selection changes, everything would remain the same. So you would not have to do anything if you don't want to make any benefit changes at all. Any benefit changes that you do make would go into effect on January 1st, 2021. And the plans that are affected by open enrollment are medical, dental, vision, legal, and flexible spending accounts. Nina, you can go to the next slide. And then plans that can be changed at any time include retirement savings plans, which those would be the 403B, the basic plan with the university match, the SRA accounts, and 457B accounts. In addition to that would be the life insurance and long-term disability. Again, no action is required to keep your current benefits unless you want to make changes to those flex spending accounts. And Nina, you can go to the next slide. And so the first topic that I'll talk about today would be the medical plans. So there's 4 typically plans that the university offers, which is a managed care plan. We also have an HMO plan, a preferred provider organization, the PPO plan, and then the traditional fee for service plan. And in addition, we also have grad care, but that is only available to benefits eligible graduate students at this time. So I won't really be getting into too much information about that particular plan. Nina, you can go to the next slide. The first plan, which is actually new for this year, that might be quite popular for employees, is going to be the Michigan Care Plan. So it's new for 2021. It's a managed healthcare plan. There is no annual deductible with this plan, so it's very similar to the U of M Premier Care. However, it does have a smaller network that is available for employees to choose from, and where you're eligible to be able to use this plan. It does have a lower monthly premium for non-Medicare participants, and some of the caveats with this plan, it also has chiropractic coverage, and then there's also a specific telehealth coverage that's through Amwell Online Care Group. And you can also use the Michigan Medicine healthcare providers. In addition, there are some smaller network providers in Southeast Michigan that do accept the insurance as well. You can go to the next slide. Michigan Care is a managed care plan, so you must live in a specific service area. And with this plan, you have to select a primary care physician that is under the Michigan Care Network. In addition, you would have to get referrals if you want to see any specialists outside of that primary care physician. In addition, it should be noted if you are going to receive any emergency services that are considered to be outside of the network, then it could potentially be covered. However, you would not be able to just go see any physician that's outside of the Michigan Care Network because they would not accept the insurance at that point. You can go to the next slide, Nina. The next plan that I'm going to talk about, which is actually the most popular plan that the university offers, is the U of M Premier Care. And so the U of M Premier Care offers the lowest cost of an HMO, and it's actually statewide network. So there's a lot of physicians within the state that do take it. It is administered by Blue Care Network. So although it is ideally set up to be used with U of M Hospital and to use Michigan Medicine, there are other providers outside of U of M that do take this insurance as well. And so you can actually go on to Blue Care Network's website to see if a physician, that you have in mind takes this particular insurance. There is no annual deductible with the U of M Premier Care, so it's really a nice benefit plan. With this plan too, it is considered an HMO, so you do have to select a primary care physician, and then you have to get referrals for any type of specialist that you do see. But if you were to travel again out of the state, potentially it could be covered if it was an emergency situation as well. The next plan, which is actually quite popular too with the university, is the Blue Cross Blue Shield Community Blue PPO. This plan is a little bit more expensive than the other plans, but it gives you a lot more flexibility. It is nationwide coverage, so you can basically see any doctor that you wish that would take Blue Cross Blue Shield. So you don't have to select a primary care physician, no referrals are necessary, so it's nice. It just gives you a lot more flexibility, but again, it is a little bit more expensive than the Premier Care. But it's very popular. A lot of employees like that because they like the flexibility with the plan, can go see any doctor. The last plan that I'm going to talk about is the comprehensive major medical plan. And so this is considered to be a traditional fee-for-service plan. It's similar to like catastrophic coverage insurance. So we don't have a lot of employees that take it, but it is still offered with the university. It's our only plan that has an annual deductible. It's a $500 deductible, and then for an individual, and then it's a $1,000 family annual deductible. It's considered to be a co-insurance, so we have some employees that will have insurance outside of the university, and then they'll take this as a backup plan. This plan, once you meet the deductible, then it's considered to be an 80-20 plan. So after you meet that deductible, they would cover 80%, and then you still have to pay 20% for any services rendered. But the nice thing about this as well, you just don't have to set up a primary care physician and no referrals are needed. So it does give you a little bit more flexibility as well with that plan. In order to determine which plan is the best option for you, you can use the health plan comparison chart on the benefits office website when selecting your medical plans. It is actually a nice tool. It does provide a lot of different services as examples for each of the plans, and it would tell you how much of the percentage that's going to be covered under the Pacific Health Plan. And then it also lays out the regions where the insurance is actually accepted. In addition, you might want to choose and look at to review the rate calculator that's available. Once you log into self-service, it will tell you how much your benefit premiums are going to cost per pay period. So if you're biweekly, then you're going to have 2 deductions come out. So they split it up over each paycheck. If you're a monthly paid employee, it would come out once a month. And so that rate calculator will tell you how much each benefit plan is going to cost for, the plans, whether it's just you on the plan or if it's going to be you and a family. And so you just basically will need to determine which plan is going to be the best option, for you and your family. Nina, you can go to the next slide. In addition, some other important materials that are available is the summary of benefits and coverage charts. So we do have those on the benefits office website for each of the different vendors. And so those do outline, specific parameters regarding, where the insurance is, able to be used from. And then it'll also outline different examples for care options as well as certain services that are rendered. In addition, one of the other popular questions that we do get is what providers can be used for particular plans. And so I would encourage everyone, if you are thinking of changing your plan for the medical, to certainly look at the provider directory that's available on the benefits office website. It will take you to each particular plan's webpage, and then you can either search by zip code or city that you live in, or if you just want to call your provider directly, or if you have a certain physician in mind, you can call them to see, if they take the particular insurance. It's actually a little bit easier to call them directly than going on the website because their websites aren't always updated. automatically. They might just do this on a quarterly basis. And so sometimes things change. Sometimes doctors are a little bit more flexible and they add plans that they're now willing to take. So I would encourage you to reach out to the doctor's office directly. Nina, you can go to the next slide. Now we're going to talk about the prescription drug plan. This actually just recently changed. So we now have a new vendor this past, I believe it was July. So everyone should have a new card if you're already an employee with the university as of July 1st. It's Magellan Prescription Drug Plan Management Group. And so you should have all received a separate ID card from them directly. And so that's included with your medical coverage. So once you enroll in a medical plan, you automatically become enrolled in the prescription drug plan. Nina, you can go to the next slide. The prescription drug copays for 2021, there's basically 4 tiers. So tier 0, that's going to be your preferred insulins and Affordable Care Act preventative products. And then tier 1 is, your generic, your low copays associated with that. And then tier 2s, those are going to be your preferred brand name drugs. And then tier 3 are the brand name. So if your physician, writes you up for a specific name brand drug where there would be no generic allowed, that would be where you'd pay the highest premium for those prescriptions. You can go to the next slide. In addition, that has been quite popular recently, just with the pandemic, we also offer a mail order supply service through Novixis. And so this is good for individuals, especially if you don't want to go out and you receive a prescription every month. You can actually get a 90-day mail order supply of eligible prescription drug medications. You have to sign up with Novixis directly. And so there is information on the benefits office website to do so. So I would encourage you, if you are interested in that program, to check that out. Again, it has been quite popular recently, just with the pandemic, with employees not wanting to go out. If they actually just get a prescription every month, it works out quite well for people. Nina, you can go to the next slide. And we're going to, I should note too, we're also going to have questions available at the end. So certainly there is the chat option where you can ask questions. And then at the end, we'll give time for individuals to ask questions as well. The dental insurance, we have Delta Dental. It is a nationwide coverage plan. And so there's 3 options that you can choose from. Option 1, 2, and 3. All 3 options do cover orthodontic services for dependents up to age 19, up to 50%. So it is a nice benefit, even if you are enrolled in the lowest option of dental coverage. And so I'll get into the specifics of each option in just a moment. Nina, you can go to the next slide. The first option, dental option 1, this is really just preventative care. So this covers basic cleanings and x-rays. It does not cover any restorative services. So if you are anticipating that you might need, a filling or any restorative services such as, maybe a filling, root canal, a crown, and an extraction, those things would not be covered at all under dental option 1. So you'd have to pay the full amount for those services. However, with this plan, it is available because it is just basic dental care. It is available at no cost to you and your dependents. So if you're not anticipating any dental services for the next year, you might want to think about taking this free option for you and your family. And then perhaps next year, increasing to a higher dental option. It's a good plan. Dental plan option 2, this covers, in addition to all the services under dental option 1, so all the preventative care, this would cover portions of restorative services. So this would cover portions of fillings, root canals, crowns, extractions, things of that nature. There is an employee contribution that's associated with this plan. So obviously, if it's just you on the plan, the cost would be a little bit different. If it's basically a whole family, then obviously the cost gets significantly more. There is an annual deductible with this plan, so it starts at $50, and then the maximum annual deductible is around $150 per family. And Nina, you can go to the next slide. Dental option 3, this also offers restorative services. It's going to have the highest employee contribution towards this premium, but it's also the highest benefit level. So it's, potentially some services you could be looking at where it's 100% covered versus option 2, it might only be at 50% coverage. So it just depends on the level of, dental services that you might anticipate that you would need. But it is a really good option for employees to take. You can go to the next slide, Nina. Keep in mind with Delta, you can go to any dentist that you would like. However, your out-of-pocket expenses could depend on what the dentist is designated at with Delta Dental. And so they typically have to decide whether they're going to be a PPO dentist or a Premier Care dentist or non-participating. So obviously, if it's non-participating, you would be responsible for any charges outside of Delta's fees. You're going to get the greater savings when you see a PPO dentist. So that's one thing to keep in mind. Certainly, if you are anticipating changing dental options this year, you might want to contact your dentist just to see what they're designated at with Delta's network. That might sway your decision a little bit in terms of saving a little bit more money. There's no ID card issued with the dental insurance. You just tell them that you have Delta Dental, and you can either give them your U of M ID number or just your last name and your social security number, and they should be able to look you up with Delta's system directly. Nina, you can go to the next slide. With the dental plan, the rates are actually just flat rates. And so everybody pays the same amount based upon what you're, enrolled in. So the dental rates are listed on the benefits office website. So it'll outline specifically whether it's, option 1 would be no charge. Option 2 and option 3 will have the charges associated, whether it's just you only or if you're going to have dependents on your plan. And then I would also encourage you to look at the comparison coverage chart if you're anticipating that you might want to change your dental insurance for the year, the dental option. This will have specific services outlined in that comparison chart. So if you're anticipating you might have to have a root canal done next year or a crown or, some type of extraction or an implant. Those services will be outlined on that comparison chart for each of the different options. And so it will tell you in detail how much percentages of those services that they will cover. Nina, you can go to the next slide. The next plan that I'm going to talk about is vision insurance. So the university does offer Davis Vision. It does allow for one standard eye exam and then one pair of either Davis Vision brand glasses or Davis Vision brand contacts in lieu of the eyeglasses. There is up to $125 retail frame allowance, so it is quite generous. Employees actually are pretty happy with our Davis Vision. Keep in mind, this does not cover any medical eye conditions. It's basically just an eye exam and then either the glasses or the contacts. If you were to anticipate any medical eye conditions, that would then get billed under your medical insurance at that point. There is no ID card issued with a Davis Vision. So you would just, same thing as a dental, you would just tell them either your U of M ID number or your last name and your social security number, and they should be able to look you up in Davis Vision's website directly. Nina, you can go to the next slide. We get this question a lot, what providers take Davis Vision. So certainly the Kellogg Eye Center in Ann Arbor, and I know in Canton, there's an eyeglass center there as well. And so you can find other providers in addition to those on Davis Vision's website. So if you just go to davisvision.com, you click on members, and you're going to enter 2032 in the control code, and that's specific for U of M. And so then you can search again by a provider name, or you can search just by your city or zip code, and a list of those providers will come up, and then you can just make an appointment directly with them if you need an eye exam. Next slide, Nina, is the legal plan. And this actually just changed names this past year. So it's still the same name, or the same plan, excuse me. It was Hyatt Legal previously, and now it's actually MetLife Legal. And so this offers various legal services if you needed to get like a will set off or estate planning or any, real estate matters handled, any family law matters, debt defense, civil lawsuits, any legal documents drafted. Typically, they can provide assistance with that. In addition, they also offer credit monitoring through Cyber Scout, and so you can sign up directly with them if you want to have those services rendered. On Hyatt Legal, Nina, the next slide, you can call them directly if you're interested in having legal services. In addition, you can just go onto their website and enter these control codes that are listed here. And you can pull up, same thing, a list of attorneys that take this insurance and that are participating with MetLife Legal within your area. So you can search by zip code, or again, if you know an attorney's name and you want to see if they take this insurance, and then basically you work with them directly to have those particular services rendered. There is a list on the benefits office website, I should know, a more comprehensive list of additional services that they do provide assistance with. And then there are some parameters of services that they do not provide assistance. And so all of that information is on the benefits website if you are anticipating using that service. One of the last plans that we'll talk about is the flex spending accounts. And so the flex spending accounts is administered by PayFlex. So we have two accounts. Basically, you can sign up for a healthcare flexible spending or a dependent care account. Next slide, Nina, is the healthcare account. And so the healthcare account is quite popular here at the university. It's used to set aside pre-tax dollars for out-of-pocket medical expenses for you and your eligible dependents. So a lot of people will use this if they already are anticipating that they have, a prescription that they fill every month, or if they know they need to get glasses or contacts, or, if there's if you see a physician regularly, doctor's office co-pays, dental out-of-pocket expenses is quite popular. So again, if you're anticipating a crown, those can be quite expensive, $500 to $1,000. So the nice thing with this plan is you can pre-elect a flat dollar amount, and they will divide that deduction out of your paycheck. So basically through the end of the year. So the accounts are typically always active from January 1st through December 31st. And so if you were to split up an annual election of $500, they would divide that by 12, basically. And then if you're monthly paid, they would take 12 deductions out each month. So it'll be, one deduction out each month over the course of 12 months, I should say. And so it's quite nice. Employees are pretty happy with it. There is an actual list, a more comprehensive list of eligible expenses on the benefits office website. And so there's information on that slide as well for that. The next slide, Nina, is the dependent care flex spending account. And so this is, again, it's pre-tax dollars to save for, out-of-pocket dependent care expenses related to daycare costs, after-school latchkey programs, adult daycare expenses. So if you had, perhaps an adult child that was perhaps disabled that had to go, to an adult daycare facility, those expenses could potentially be covered under this. Summer day camp programs can be submitted for reimbursement on here. So it's quite nice. People, typically are pretty happy with this plan. There's a list of eligible expenses, again, on the benefits office website. And so I would encourage you to review that information there if you had questions about it. On the next slide, some contribution limits. These are very important. With the healthcare account, it's $120 is the annual minimum election. And this actually, the maximum is increasing this year. So it will increase by $50. It's $2,700 currently, and then it's going to increase to $2,750 as of January 1st, 2021. The dependent care account has a bit more parameters around it in terms of maximums. So it's $120 as the annual minimum election. And then the maximum depends on your annual earnings in the prior calendar year, your tax filing status, your spouse's annual earnings. So there's a lot of different parameters around that, but the benefits office has a lot of information about this. And then it can kind of walk you through how to calculate what that maximum contribution could be for the year. Next slide, Nina. Some important reminders to keep in mind if you're thinking about electing the flex spending accounts. It is a use it or lose it feature. So again, if you elect too high of a deduction, unfortunately, there are only specific parameters where you can make changes mid-year. So certainly if you had a qualifying event, then perhaps the benefits office will allow you to make changes to it. However, typically the account is set up to be a use it or lose it. So you don't want to get into a situation where, you elect too high and then unfortunately, you think you're anticipating a dental service and then, you find out you can't have it. Then you have all this extra money that you need to use by the end of the year. And so there's only certain parameters where you can use those flex spending accounts. There is a grace period at the end of the year. So you have technically until March 15th to incur any eligible expenses. So a lot of times if employees have some money remaining, they'll use it to get glasses or contacts. Things of that nature can be used at the end of the year. And again, this plan is the only plan that you have to actually re-enroll in every year because it is based upon an annual calendar year for which you want to participate in. And then one piece of advice is to maintain all of your receipts and documentation of purchases for the flex spending accounts. They do annual audits for the PayFlex. And so while you certainly can go and, pay for your expenses with that preloaded credit card, you might get a letter from them, 6 months later, just saying, hey, we need a copy of those receipts. We're just doing an annual audit. We just want to make sure that those were legitimate expenses that you used to pay for those services. So I would encourage you to save any receipts that you get because again, the audit is random. And so they could, just want proof of those services that you used to use the card for. Next slide, Nina. Again, benefits that can be changed at any time are the retirement savings contributions. So the 403B, the SRA, the 457, those Roth savings plans, life insurance. So a lot of people, when they log in next week, they'll say, hey, my life insurance isn't showing up on my open enrollment. Why is it not there? No, it's still there. It's just the open enrollment is only limited to certain, plans that can be changed. So certainly, your benefits will still be intact, but you can make those changes at any time. So you can enroll, increase, decrease, or withdraw, for your optional independent life insurance. And then also the long-term disability, same thing. It won't show up in your open enrollment. However, you can make changes to that at any time. Next slide, Nina. Again, so it starts Monday at 8 a.m. So you'll be able to log right in under self-service, and then you can keep going in and out of it for the next 2 weeks. So if you want to keep making changes to it, that will be available for you, even if you already submit it. You can go back in and make additional edits until 5 o'clock on Friday, October 30th. And again, those changes take effect on January 1st, 2021. If you're happy with your current benefits, again, you do not need to do anything to keep them, with the exception of the flex spending accounts. That's going to be the only plan that you have to go in every year to re-enroll in. And I'm happy to answer any questions that anyone has. Or again, you can send me an email if you, just want to send me something privately, if you have a specific question related to your benefits directly. But again, I'm happy to answer any questions that anyone has.